Good afternoon, and welcome to this afternoon's special meeting of Perth and Kinross Integration Joint Board. First of all, can I ask if there are any apologies for this afternoon's meeting?
Yes, Chair. Thank you. Good afternoon, members. We have apologies today from Jackie Pepper and also from Alan Drummond as well. I'm happy to go through and do a roll call of those present if you would like.
Yes, if you would please, Scott, thank you.
So if I can just, when I call out members' names, if they can just indicate that they are present on the call. Councillor Duff.
Present.
Councillor McDade.
Present.
Councillor Purvis.
Present.
Bob Benson. I think Bob was having some technical issues, so we'll hopefully try and get Bob into the meeting. Ronnie Erskine.
I'm here, Scott, and I'm an email contact, having just phoned Bob, so he's going to send an email shortly. He can't get in. Cheers.
Okay, I'm sure colleagues will continue to try and help to bring him in. Pat Kilpatrick.
I'm here.
And we have Dr. Pratt substituting for the vacant position.
Yeah, here.
Thank you. Gordon Patterson.
I'm here, thanks.
Jane Smith.
Present.
Thank you. Dr. Robertson. I don't know if we have Dr. Robertson. Sarah Dickey.
Present.
Bernie Campbell.
Present.
Stuart Hope.
Present.
Sandy Watts.
Present.
And Lynn Blair.
Present.
Thank you. And we also have Sandra Auld and Ian McCartney in attendance at the moment, pending the decision or approval on their membership. Thank you.
Thank you very much, Scott. Okay, moving on to item 2 on the agenda, declarations of interest. Does any member wish to declare any financial or non-financial interest in any items on the agenda this afternoon? If so, please put DI in the chat. I'll give it a few seconds to see if anybody does. No declarations of interest. Okay, thank you. Moving on, therefore, to item 3 on the agenda, which is a membership update. And again, if I would ask the clerk, Scott Henry, to speak to this item on the agenda, please, Scott.
Thank you, Chair. As members will note from the agenda, we now have the outcome of the election process for the service user main representative and substitute representative. So the board are just asked to confirm the appointment process and to confirm that Ms Sandra Auld be appointed as the service user representative, with Ian McCartney as the substitute member, with both of these appointments being on an initial 2-year period.
Okay, can I take it? Are there any objections to this proposal? If so, please put a question or comment in the chat function. Councillor McDade.
Thanks, Chair. It's not an objection at all, and I'm very pleased to welcome both to the board in terms of returning and Sandra Auld's case. I think she's a very valued member. No, my question was actually just around the wording. Both these are appointments to be on an initial 2-year period. I don't quite understand what we mean by initial 2-year period. Are they up for re-election after the 2 years? Certainly, I think last time it was on the basis that it was a 2-year appointment and then it was up for re-election. Could we just get some clarity around that, please, from the clerk?
Certainly, Scott.
Yeah, Chair, sorry if the wording's maybe not totally clear. It is to reflect the fact that the appointments will be for 2 years, and then there will be the opportunity for the current members to stand again, but that would be part of an election process. So they could, there is the opportunity for reappointment, subject to that being through the election process or any other process that the board wishes to determine at the time.
Okay, could we perhaps just maybe reflect that slightly better in the wording so that it's clearer for the public? Just because I think, because there's public service user reps, it's important that people understand the transparency of their appointment and their process. So, but very, very pleased to welcome both to the board. Thank you, Chair. Okay, thank you. If there are no further questions or comments, can I be the first to congratulate both Sandra and Ian on their appointments. Your role going forward is extremely important to us all on the Integration Joint Board, and we look forward, in Sandra's case, to your continued very valued input into the deliberations of the board, and in Ian's case, you're very welcome, and we look forward to receiving the benefit of your wisdom over the coming initial 2 years and hopefully beyond. So you're very welcome, and thanks for attending today. And that's the end of that item at the moment. And if I can just therefore, seems strange, we've only been in the meeting for 5 minutes, but can I now move on to the final item on the agenda today? The single substantive item on business, which is the budget for 21-22, which is obviously extremely important, and this follows discussions both in board session and in budget review group session and development session prior to today's meeting, and this is the culmination of the efforts of the prior discussions of the committee, and more particularly as well the work behind the scenes by Jane Smith and Gordon Patterson and their colleagues in developing this budget and working both with Perth and Kinross Council and NHS Tayside in that regard. So without further ado, can I pass over to Jane Smith, the Chief Financial Officer, to provide the report, please. Jane, thank you.
Thank you very much, Chair. Good afternoon, members. I'm delighted to present the Perth and Kinross Integration Joint Board budget for 21-22 for approval today. I'm very grateful to IJB members who've previously agreed to the setting of a one-year budget, recognising the extraordinary events of the last 12 months and the uncertainty that remains as we remobilise services. The proposal set out in the paper the conclusion of significant work, as the Chair has mentioned, undertaken by service colleagues and the finance team in very difficult circumstances, and I too would like to pass on my sincere thanks to all of my colleagues for their hard work, and indeed to the support of IJB members through the BRG meetings and the development sessions over the last 4 months. Whilst we are very much an integrated joint board, the budget remains in 2 distinct parts, reflecting the financial risk-sharing arrangements that continue to underpin the IJB 5 years on. I will therefore take each budget in turn, highlighting the overall outcome of the budget process and providing a further update on the implications of announcements made by the Scottish Government since finalisation of these papers in mid-March. If I can take the social care budget first of all, I'm delighted that a balanced one-year budget is presented for approval today, and whilst an underlying deficit has now emerged due to the sheer scale of pay and price pressures in comparison to the level of funding being made available, a balanced plan is being achieved through the use of non-recurring reserves, non-recurring support from Perth and Kinross Council, and an underlying assumption that all COVID-19 costs in 21-22 linked to our remobilisation plan, which will be considered by the IJB on the 24th of April, will be covered in full by additional funding. Subsequent to the finalisation of the paper in front of you today, the Scottish Government and COSLA agreed on the 24th of March to an overall 2.2% increase to the full hourly rate for social care commission services. This is regarded by the Scottish Government as an early commitment to the implementation of the findings of the independent review of adult social care. It does, however, create an additional cost pressure for health and social care partnerships across Scotland, which is likely also to have implications for the settlement of the National Care Home contract. I'm pleased that confirmation was received on the 26th of March that £30.5 million of additional funding will be distributed to health and social care partnerships across Scotland to meet the full costs of the new living wage commitment and towards the uplift in the National Care Home contract. Perth and Kinross have been allocated £923,000 proportionate share. At this stage, it's not possible to finalise in budget terms the implications of the additional costs and the additional budget on the recurring position of the IJB until the National Care Home contract uplift rate is agreed. It's hoped that that will be settled imminently. The additional funding received, however, is fully expected to meet additional costs, and any impact on the recurring deficit in the social care is likely to be positive. A further formal update will be provided to the IJB at its meeting on the 24th of April. I should also highlight that the outcome of the local authority pay negotiations led by COSLA are still underway, and there may be cost implications of that, but there are not expected to be budget implications of that pay settlement. I also wanted just to take the time to recognise that in relation to the independent review of adult social care, the Scottish Government and COSLA have issued a statement of intent which, subject to the outcome of the parliamentary elections, prioritises a number of recommendations for delivery in the year ahead. This includes the ending of charging for non-residential social care services as soon as possible and the overhaul of eligibility criteria. It's important for the IJB members to be aware of the potential significant cost implications of such commitments, albeit that it may seem unlikely that there will be budget implications for 21-22, and full briefing will be provided to IJB members at the earliest possible opportunity. And of course, the IJB members have a briefing session next Wednesday in relation to the overall review. Moving on to the health budget. At the time of issuing the paper, a balanced budget for delegated health services was not able to be presented, although it was noted that positive discussions were taking place with the Director of Finance at NHS Tayside around the possibility of bridging finance. And I'm very pleased to advise that we have now reached agreement to the transfer of £1.4 million additional non-recurring budget from NHS Tayside to Perth and Kinross Health and Social Care Partnership in this financial year to be carried forward to 21-22 to support the IJB's financial position, thus ensuring a balanced budget. I'm also pleased that regular meetings are being set up during 21-22 by the Director of Finance to ensure ongoing review during the year of both the financial positions of the Health and Social Care Partnerships and that of NHS Tayside. I'm delighted that joint working over the last 2 weeks has successfully got us to the position which allows both the IJB and NHS Tayside to focus on the positive aspects of remobilisation and longer term planning and move us away from short term financial recovery. In relation to further activities since the budget papers were circulated, you will, I'm sure, be aware that the Scottish Government announced on the 24th of March that NHS staff would be offered a 4% pay increase backdated to December 2020. A 4% uplift increases our pay costs by £1.3 million. This is pleased to say that the Scottish Government have now confirmed that both the backdated element and the 21-22 recurring costs will be met in full by additional funding. I also want to mention mental health services. The Scottish Government final budget approved on the 10th of March included £120 million of non-recurring investment in what is now being described as the Mental Health Recovery and Renewal Fund. On the 24th of March, The Minister for Mental Health set out investment priorities, including child and adolescent mental health services, psychology services, primary care services and wider community services. Although this funding is currently non-recurring, the Scottish Government have recognised some elements of the plans will be required to be recurring, and they've advised they will work to address this in the next spending review. Full updates on the allocation of this important funding will be provided to the IJB at the earliest possible stage. We are not clear at the moment how much and if that funding will come to integration joint boards. I really want to leave it at that. The final point I would like to make is the positivity of balanced budgets now on both the health and social care side, and that assuming there is approval by IJB members today, we will be in a position to issue very straightforward directions to NHST side and to Perth and Kinross Council in relation to the budget. I'm sure Gordon, myself and the rest of the executive management team would be very happy to take any questions.
Okay, thank you, Jane. Gordon, I don't know if you had anything to add at this point in time at all, or are you happy just to go straight to questions?
I know I would really just probably want to endorse what Jane was saying about the welcome progress that's been made and the updates that she's provided. Hopefully will apprise IJB members of the position that we hope to be in moving forward. I'd also like to take the opportunity to extend my thanks personally to Jane for the work that she's been doing in this, and particularly also in Donna Mitchell, who I know is with us today, but is probably too modest to step forward. Although we will keep in reserve the potential that Donna can answer the more difficult questions.
Right, okay, no, thank you for that, and yes, thanks especially to Jane and Donna for the work that they've done in getting to this stage. I'm now going to open the floor, so to speak, the virtual floor, to questions from members. If you have a question, can I remind you, please just type a Q in the chat function. If you don't have access to the chat function, if you can put your camera on and wave, that would be an appropriate alternative. And first of all, we have Councillor Purvis.
Sorry, another situation where an email blocking my ability to unmute myself because of where Teams has now located thank you very much for that update, Jane. You have actually answered most of the questions that I had listed, which I suppose will help with the running of the meeting, so I'll just go to those other ones, but I'll come back to some of the points you've made in comments if that's all right, Chair. The first one was just about the free personal care, the uplift in the allowance there, which obviously is very welcome, but notwithstanding the points you made about additional commitments in terms of pay, I think it was, on the social care side, we still got the reduction in the allocation that we were thinking we were going to have. Is that correct? Is there any specific funding that has been allocated for the change in the free personal care allowance?
If I could answer that, Chair, thank you for the question, Councillor Purvis. Yes, the 72 million additional social care funding that has come through in the budget specifically provides earmarked funding for the increase in free personal care above that which we were assuming. However, what that means is that in terms of the overall allocation that we're getting, there is not much left over to go towards anything else.
Okay, so it's ring fence for that specific purpose, but the total, we were expecting 90 across Scotland, and that's been reduced to 72 or whatever it is. Right, okay, yes. That's clear, thank you. The next question was about the income that we'd have been anticipating from the contributions policy. I know that this is one that has been around for quite some time, and clearly because of the pandemic, it reduced our ability to complete that consultation. While that's been put in as a non-recurring pressure for the next financial year that we're just about to go into tomorrow, I think I remember from some discussions, and the Chief Officer can maybe correct me if I'm wrong, that while that's already been reduced from the original target, that perhaps even if we do get agreement, that it might not be of that magnitude? Now, first, am I right in that? And secondly, should we therefore be changing our assumptions in terms of the recurring pressure, or is that something that we can deal with in the next budget?
Yes, Gordon.
Thanks, Councillor Purvis. I'll answer that question as I understand it. Certainly the figure that is in the budget report, which the Council have awarded to the partnership on a non-recurring basis in order to offset the fact that we didn't advance the charging policy, the contribution policy in the past year, is I think 705,000. That is the figure that we had anticipated we would generate following the implementation that Councillor Barrett brought forward to the budget budget discussions last February. We had previously a figure of potentially 1.2 million, but ultimately we narrowed that down by building in some additional protection by focusing only on those 5 potential development recommendations revisions. So there was a figure of, I think, 705,000 that was in our budget proposal for last year as additional income that we had sought to generate, which the Council has awarded us this year to recognise the fact that we haven't managed to generate it. But on a recurring basis, that becomes a gap in our budget unless the Council decides to address that.
Okay, thank you, Chief Officer. No, I think I got that, as you say, as a result of the Liberal Democrat amendment, the budget before last, that it reduced the envelope effectively for what we were looking to achieve. My question was, do we think that we can achieve that, or indeed is it desirable to achieve that as a result of the outcome of the consultation, or are we not at that stage to make an assessment on that yet?
So the consequences of COVID mean that we need to revisit the consultation and engagement that we carried out. We would like to review the extent to which it was robust and comprehensive enough given the limitations of having to do it virtually. There is also, though, the opportunity for us to look at whether or not with the relaxation of restrictions we may be able to consult further. The more significant variable that might come into play is the recommendation, as Jane has alluded to in the Feely review, that non-residential charges should be abolished, and which, through the statement of intent that was signed up to last week by the Scottish Government and COSLA, that seems to be the ambition, the joint ambition moving forward. So if we're not allowed to charge for non-residential services, or if people who receive those services are entitled to receive them free at the point of delivery, that will both preclude us from generating that additional 700,000, but will also reduce significantly, or will clear the income that we currently generate through that charge. But one would imagine, because Feely recommended it would be necessary, that 55 million, I think, be set aside by the Scottish Government to offset to the local authorities the loss of income if that policy was introduced. That whilst we would be able to cover our existing income, if that comes to pass, we would still have the 705,000 as a gap in our budget moving forward.
Okay, thank you. And Chair, just if I may, one final question.
Yep.
That's very welcome news, Jane, about the additional funding from NHS Tayside, bringing that other side of the budget into balance, which is obviously development from the previous discussions that we had had. I know that I had raised in those discussions about, and it is referenced in the papers as well, looking to see if we could get funding from the Scottish Government to plug the gap in relation to COVID savings that have been delayed as a result of COVID. Did those discussions take place? Is that something on a nationally that looks like it might be able to happen? Because clearly we welcome the money from NHS Tayside, but if that's something that could happen in addition, that obviously would give us additional scope. But maybe I'm being too ambitious there, but I think I'm going to ask the question anyway.
If I could answer that, and thanks again for the question, Councillor Purvis, you're absolutely right. We have raised in previous discussions the potential for discussion with the Scottish Government around exactly that. However, as things stand at the moment, there is no further update. We had a national network meeting of CFOs earlier this week, and Scottish Government were not able to advise on any further update in relation to their thinking in terms of slippage on savings. But we will keep abreast of those discussions, and again we'll have an opportunity to update you at the meeting in April. We're fortunate actually that we have a further IJB meeting in April where we can perhaps bring some of these things to conclusion.
Okay, thank you, Chair.
Okay, thanks for these questions and answers, and I'm now moving on to Pat Kilpatrick next. Pat.
Hi, thank you, Chair. Hi, Jane. I've got a couple of questions really. The first one is about the slippage in the savings delivery in the health budget, which is about 1.376, I think. And it's to what extent do we think now? I mean, I know we're in a pandemic and we've been through a dreadful year, and you know it's difficult to keep doing the day job whilst we've been managing such complex service delivery. But do we think really now, if we look back on that's a realistic figure? You know, the reason I say that is, can we put a hand on heart and say that 1.376, you know, we've reviewed and that we think we can achieve it in the coming year? A couple of other things were some of the demand pressures may raise my eyebrows a wee bit. One was that pharmacy costs in primary care are going up, when the trend overall is that pharmacy costs would go down. That's why we've invested in all these pharmacy support workers and pharmacy assistants and indeed pharmacists to put into practice. That part of the job in there is to review medication and compliance and multiple medications and make sure that people are using generic prescribing and not prescribing long term without reviewing, so patients are just not getting the same prescription year on year and year when they might not need it anymore. That has generally been accompanied by a decrease in prescribing. And the other thing was occupational therapy equipment. The demand for that was going up, and you know that it's difficult to imagine how that could be so great that, you know, it became a real demand pressure in its own right in a financial plan. So those were a couple of things, and I'll just give you all my points at one, Jane, and you can come back to me. The other thing was, I feel that now this is just my observation, if you like, I think the transformational strategy work that will deliver the real sustainable long-term improvement and reduction in costs, bringing us into a sustainable budgetary position. I think there's lots of opportunities from what I can gather to try and shift the balance of care more into primary care. That might need to negotiate a communicated terms of agreement with NHS Tayside about if we provide a minor injury, minor illness service in Perth in the town, which takes all the category 4 and 5 triage patients out of PRI, we'll be able to see some transfer in resources to take account of that. And I think we're going to need to show that there's got to be some kind of war chest or investment fund that we've got there to pump prime, save to, you know, invest to save type initiatives, so that you're not just going to save money out of nowhere. And the only way you do that is by shutting things down, and in the current climate that's not really achievable. So we're looking at where we can take the balance of care, but we need to probably disinvest in some other facilities or some other services. So I suppose I'm really looking for a transformational strategy which would be costed and would be a part of a sort of memorandum of agreement, if you like, with NHS Tayside that looks at more radical service models and would deliver us a more sustainable financial position. So those were my kind of key points. I'm not a figures person, but I'm really trying to think about what the service changes could be that would deliver the financial sustainability that obviously you're working so hard towards achieving, Jane. Thank you, Chair.
Thanks, Jane.
Yes, I'll try and answer each of the questions in turn, Pat, but I'm sure my executive team colleagues will want to also support the discussion. If we can take first of all your concerns around delivery of existing savings plans, the core element of those plans for 21-22, albeit that we are expecting significant slippage, we have reviewed those plans and do believe they are still absolutely the right things to do. And the core element of the health plans are the integration of our teams. That's the integration of our health and social care teams, which absolutely remains the right thing to do. And some may question why 5 years on those savings haven't been achieved before, but these things take time. We've got further teams that we are looking to integrate, so these savings are still the right thing to do. The other key aspect of those savings is the review of our rehabilitation beds, and again, that is very much at the forefront of our plans. It does need significant work, significant engagement, but the overall requirement and distribution of beds, as things stand, even through the eyes of COVID, that still is the executive management team believe is the right thing to do. So there are no barriers to the transformation aside from the capacity of the management team to see those particular significant savings plans through, and we have given that careful consideration. Colleagues may want to come in, but if I can just go through and turn your further points. In relation to prescribing, I accept and agree with your assessment that we should expect to see the item costs in prescribing coming down. We've a very extraordinary year that has just passed, and it's very difficult for us to make any kind of assessment around what is driving this increased cost and whether it is related to aspects of COVID or aspects of our departure from the European Union. These are questions that we are asking of our NHS Tayside expert colleagues in the pharmacy department, but as things stand at the moment, we are reliant on their forecasts for next year, and this is what they're telling us. But very quickly, as part of our QSEP, our quality, safety, efficiency and prescribing work, we very quickly, Pat, I totally accept, need to wrap round, better understand and start to do start to get back on track exactly the initiatives that you've described in terms of that core role of pharmacy colleagues to drive quality at the same time as reducing costs. So we utterly take that on board and are looking to re-energise our QSEP programme at the earliest opportunity. In terms of OT equipment, those members who've been with us since inception will probably recognise that in the early budgets and in the face of extreme demographic growth in terms of our elderly population, we included nothing for OT equipment demands. And that extraordinary demographic growth in Perth and Kinross, which is well above many parts of Scotland, is having a direct impact on the level of OT equipment installation that's required. That's not a surprise to me. It was a surprise to me why we had not considered before now the need to make budget provision for that significant demographic growth and impact on that budget. I'll probably pass over to Gordon in relation to wider transformation strategy, but what I would say, Pat, is that right through the middle of the 3-year financial plan that came to the IJB last year was exactly what you've described. It was upfront investment in our integrated care teams and our respiratory models, with the very plan of then being able to reduce the number of inpatient beds that we have and shifting the balance of care. Now what we need to do is build on that through the lens of COVID to look at our huge success in reducing delayed discharges, one of the best performances in Scotland in relation to levels of delayed discharge, the huge impact that that's had on level of occupied bed days in acute hospitals over a COVID year, and how we can sustain that with the models that we've put in place over the last 12 months and how we build a next step older people transformation programme, and that's right at the heart of what we are moving on to do when operational demands recede and we can start to focus on strategy. But your point about investment funds, pump priming to support that, I absolutely couldn't agree more, and that was one of the focuses of the discussion with Stuart Lyle, the Director of Finance at NHS Tayside, who fully recognises the need for us to be starting to build that war chest so that we can pump prime change.
Thanks. Is that okay, Pat? You happy with these answers?
Yeah, I am. I'm not really happy with the prescribing. I'm happy with Jane's answer. Of course, I am. I just wonder that how are we going to be assured as board members that we've got a grip on the prescribing budget, that GPs are bought into this, that we've got suitable influencers in the GP community to deliver that, and that we can start. We've got enough information about the practices and what direction they're going in, and whether it's going up, whether it's going down, or we begin to see some trend analysis. I think if I saw that, I would feel more comfortable with it. It just feels a bit counterintuitive at the moment, and I don't quite understand why, because we put so much money, or you have put so much money into prescribing, that we really should be able to see the tide turning on that, as other places are. So that's maybe an issue of leadership. I don't know, maybe it's an issue of influencing it. There could be other factors, but I'm not persuaded by that one, Jane.
Okay, so I think Gordon would like to come in there and make a comment, Pat, if that's okay.
No, I mean, I think we can support GPs and pharmacists to effectively manage in an efficient and standardised way the use of their prescribing budgets. We're less able to influence the cost of medicine and the formulary, so there are variables that are beyond our control. But certainly, I think it would be probably quite useful if we could bring a specific report to the IJB about the work of our QSIP programme, and our pharmacy lead could speak to the work that's being done. And I think it would be probably very useful to reflect that in the context of the savings that have been achieved retrospectively, as well as probably try to provide a bit more narrative, Pat, to clarify your concerns, or to address or explain the reason why we are projecting, continuing to project further increases. So I'd be very keen that we do that. I see also that Sarah Dickey had her hand up, and I don't know if it was in a similar point that Sarah wanted to come in.
Oh, I don't see Sarah. Sarah, you're very welcome to come in.
Yes, thank you, Chair. Thank you, Gordon. Yes, Pat, in relation to your observation around how are we seeking assurance as board members, it was just to share information that the prescribing management group, who is currently chaired by Dr. David Shaw, have continued to meet throughout COVID and continue to meet. Actually, there was a meeting today, and all three health and social care partnerships and the CUTE are represented on that forum. So as Gordon has suggested as Chief Officer, I'm sure we could contact that group for any additional assurance that you might be looking for. Thank you.
Thanks for that. Thanks for these additional comments. And Gordon, you want to come back in again? Last time your picture froze, now your voice is frozen as well, but maybe you're back now, hopefully.
Sorry, I should unmute my mic before I speak, or maybe you wouldn't agree depending on what you're about to hear. I just wanted to maybe make some comment about Pat's very astute and helpful comments about the ways in which we may seek to more formally come to an agreement with NHS Tayside around how shifts in the balance of care may well be more effectively matched by shifts in the balance of resources. I think that's something that we need to do, and actually we began to touch on some of this with Stuart Lyle in our discussions earlier this week. But as Jane says, our delayed discharge performance has consistently, since the advent of the pandemic, been amongst the top 2 or 3 mainland authorities in Scotland. Since the inception of the Health and Social Care Partnership and the integration authorities, we've probably gone from a position of around 18,000 bed days lost a year to round about 8 or 9 or 10,000 bed days lost a year. So there are provisions in the integration scheme and in the integration legislation, and it is an ambition of that legislation to see the resources shift upstream to support the investment in community infrastructure that enables people to remain at home safely, healthily, independently for as long as possible. But I don't think anywhere in Scotland has seen money coming out of the NHS into community services through the large hospital set aside, because acute hospitals are still being run and are still being invested in, and are experiencing the same sort of demand pressures, and inevitably are having to respond to that. So there are significant challenges there, but it should be noted that Stuart Lyle has identified, or had identified last year, some particular funding to support shifting the balance of care, and in effect, I think some of the additional investment that he has committed to provide to the partnership this year is really enabling us to look at how we might do that transformation and do it much more effectively. Has to be said that we have had a transformation plan. We've invested about £1 million in links and in other community services. That's been our own money. That hasn't been growth or pump prime or change fund. So it continues to be a challenge. You know, the ambition of community care and supporting people in their own communities was probably first articulated in 1990 under the Community Care Act, and local healthcare cooperatives before CHPs, before integration authorities, have sought to advance this. We need to look at what we can do to achieve that, rather than wait for the National Care Service to come to our rescue.
Okay, thank you very much. I'm sure you'll agree, Pat. You've had very comprehensive answers as always to the questions. Are you okay with your answers that you've received? Yeah.
Yeah, I do think we need to bring a revised, updated transformation strategy with some indication of what the discussions would be as to how to release resources to invest in it, because I think that's the only long-term sustainable financial plan we'll ever have. And I would like to see more of the pharmacy information, and I would like to know who the GP champion is and what the GP is, what do they feel in their individual practices about how we can do this, how we can achieve a reduction in prescribing. But I thank Gordon very much for his input and his answers. Thank you, Chair.
Okay, thank you. Okay, before we move on, I'm delighted to see that our Vice Chair Bob Benson has managed to join on the phones. Bob, hello, good afternoon.
Good afternoon, Eric, and thanks to Lee and others for helping me to at least join in some form. Thank you very much indeed, Eric. I didn't have the opportunity to hear Jane's verbal update, so particularly in terms of the bridging loan, which I think had been mentioned. And I wondered if you could refresh that for me, please.
So, Jane, are you able to respond to Bob's question? Sorry, I didn't realise you had a question, Bob, but are you able to respond to that, Jane?
Of course, Bob, just to let you know, since you've missed it, that we had some very fruitful meetings with Stuart Lyle, Director of Finance at NHS Tayside, and have agreement to the transfer of additional resources this year that can be carried forward as part of our underspend to support and allow us to have a balanced position next year, very much with the intention to give us the space to take forward exactly the approach that Pat's described, to focus on longer-term transformational planning and you know, allow us to move on from short-term recovery measures, which may have been of us had this funding not been made in relation to bridging finance.
Unfortunately, you distorted a wee bit there at the end, Jane.
I think I got the gist of it. I suppose the question for us in terms of thinking about recommendations, Chair, is that does that offer constitute a legally approved sum for bridging that would actually be approvable by the board. And because at the moment we have an unbalanced budget awaiting either requisitions or bridging loan finance. And I suppose what I need to know, given that this is a public meeting and a public decision, is that reassurance from the Director of Finance at NHS Tayside. Does that legally meet our requirement for a balanced budget when we come to make decisions at the end of the day on this?
Yeah, and again, it's unfortunate you missed Jane's comments at the start, but Jane, if you could just recap on that element of what you said at the start for Bob's benefit.
I'm sorry, Chair, I'm not exactly sure which element you're asking me to repeat. What I can assure the board is, based on the commitment given to the Chief Officer and the Chief Financial Officer by the Director of Finance at NHS Tayside, sufficient resources will be passed across this year to be carried forward in a reserve that will allow us to present a balanced budget. That is not to say that we will be able to deliver a balanced financial position. There's a huge level of assumption and risk attached to the assumptions within the budget. That's the same as any other budget. But we will, if it's helpful, what we can do at the April meeting is bring forward a short paper that feeds in and provides additional reassurance of that formal position.
Yeah, that would be helpful. Thank you.
Thank you, Chair, and thank you, Chief Finance Officer. In terms of the legal position for the IJB Chair, would that be sufficient, according to Scott's view, for us to proceed, even with uncertainties, as all budgets have uncertainties? Would that still legally enable us to proceed? If Scott could give a view on that, please.
Okay. I think I think really what Jane is saying is that this is a budget setting. This is not a fixed position thing. These things evolve over time. We are saying that there have been assurances received, and that would be the normal basis upon which we would proceed to setting a budget. But I don't know if Scott or Gordon are able to add to that.
Scott, do you want to?
No, Gordon, on you go.
No, I mean, my view, and I think Jane would likely support this, would be that what we're doing is presenting to the board today the information that enables us to assure you that we have had offers of funding from both statutory partners that meets our expected demand moving forward and addresses any shortfalls that we had identified because either we hadn't made the savings or because we hadn't achieved the income. So we would be recommending that the IJB accept this budget, particularly in view of the fact that we have reserves in relation to the Council's award that enables us to offset a deficit that would otherwise exist. And we now have an enhanced offer from NHS Tayside that matches the gap that we had previously identified in our budget moving forward. So hopefully that provides a degree of assurance. Whether that's legally binding, I'm less sure about, but what we would tend to do after this meeting is issue directions to both statutory partners seeking a requisition in relation to the funding that we need to do the business of the Health and Social Care Partnership in pursuance of the IJB's strategic objectives for the next year, and hopefully that would be adequate for the purposes of today's meeting.
And I think if I can just add in relation to that, Bob, as you'll note from 1.5 in the recommendations, that is an integral part of what the IJB is going to be recommended to do at the end of this discussion. So if that's okay, we can proceed on that basis. But thank you for.
If I may pursue this, and I'm a bit of at a loss, Eric, because obviously I can't. I know you may have other hands up as well, so I'm sorry for this. But I suppose the issue for me is that, thinking ahead, is that even with a bridging loan agreement, we're still faced with some difficulties in terms of cost cutting, because a bridging loan would have to be repaid unless we were committed to using reserves, and we would still be seeking a lot more clarity, I think, on cost savings themselves, which is quite a difficult issue. And that's the reason why I'm going down this road, because I need to know where we actually stand in this, because the long-term issue is that cost savings have got to be real and identifiable and sustainable for our long-term future as an IJB. So that's simply why I'm raising that issue.
No, I understand, and I think Jane wants to come in and comment on that specific point. Jane.
Thank you, Chair, and thank you, Vice Chair. I suppose to be clear, we are not formally being expected to repay this. This is not an arrangement whereby we're being expected to repay the bridging finance that's been made available. That's the case with the non-recurring funding, both from NHS Tayside and from Perth and Kinross Council. I would remind members that one of the reasons this is a one-year budget is because we've been very frank about the fact that due to the pressures of COVID, those longer-term savings, those recurring savings that will support recurring financial sustainability, we've simply not had the time to pursue that. We fully recognise members' concerns in that respect, but I would remind members that's why we've agreed to a one-year budget at this stage, and our attention will turn to the longer-term cost savings, transformation and sustainability discussions moving forward.
Okay.
Thank you very much indeed, Chair. That's helpful that we don't have to repay this loan, but there would necessarily be other terms and conditions that would go with it. And I think one of the things that I would like to see is some clear identification, say by the next IJB, of how we intend to spend these monies now that the whole has apparently been addressed in the budget.
Okay. Okay, thanks. Moving on to further questions, therefore. And what I would say is we have currently 4 more questions before us. I notice Ian McCartney has put a comment in the chat, and Ian, and I think for other public partners who haven't spoken as well, you know, given the importance of this debate, I'm exceptionally going to allow contributions from substitute members during the course of this debate. I'm anxious to encourage that, and it's, as I said at the start, is the direction of travel that we want to have as much input from public partners. But I will go through the substantive members' questions first, and then come back to Ian and any of the other public partners if they have questions or comments after that. So firstly, moving on to Bernie Campbell.
Hi, thank you. My question is regarding the funding that the partnership have received from the Scottish Government for the implementation of the Carers Act for 21-22. I believe that this is in the region of 750,000 or so, and I'm really only looking for confirmation that this will be solely used for the benefit of unpaid carers. I do appreciate Maureen and I have had the opportunity earlier in the week to have initial discussions with Gordon, but I would just want confirmation of that if I can, please. Thank you.
Okay, Gordon or Jane going to respond to that one?
Yes, let me please respond to that. So we have built into the budget the provision that we had anticipated in relation to additional funding for unpaid carers, and that pertains to a figure of £250,000 that we were expecting this year. However, what became apparent was that in the financial memorandum from the Scottish Government, they indicated that they would be providing an uplift to that amount, and the amount that we received was, I think, 803,000, Bernie. Now, what the financial memorandum recognised was that this was to offset the take-up of carer support in previous years, which had been much higher than predicted, and the funding that was provided in early years of the implementation of the Carers Act didn't meet this demand. So essentially what we've sought to do is to apply the difference between the 250,000 that we had expected, which remains available for the Carer Strategy Group to allocate on new service developments. The difference being 535,000, we've applied that instead to existing commitments that we've made over the duration of the carer strategy period to sustain existing packages of replacement care, so that the arrangements that we've put in place that haven't hitherto been funded are now able to be funded and able to be sustained and to meet the commitments on an ongoing basis. So the 250,000 is the new money that we had expected, and that, as I say, is available for the Carer Strategy Group. I do understand that some of it has perhaps already been committed, but there will be clearly discussions within the Carer Strategy Group around what priorities that should be directed towards, very closely aligned to the published and approved carer strategy that we published whenever it was, 18 months ago now. So yeah, there'll be opportunities for further investment, but the difference between that which we had expected and that which we had been awarded has been used to offset some of the demands that we were already experiencing.
Okay, thank you, Gordon. Okay, Bernie? Nope. Is that okay, Bernie? Yeah. Yeah. Okay, so now we're moving on to Councillor McDade.
Thank you, Chair. Yes, I've got a few questions, and if I can possibly take them one at a time, please, Chair, just I think to make it easier. So the first one is a follow-up from Mr. Benson's question earlier around point 4.7.5 of the report. It says discussion is underway nationally around the ability of NHS boards, HSCPs, to manage the slippage in savings delivery in 2021-22 locally. Positive discussions are also taking place with NHS Tayside around potential bridging finance, with details currently being worked through. Now, Mr. Benson mentioned this as a bridging loan, but obviously bridging finance can be read in a number of ways, and I would like to just establish the absolute clarity as to whether it's an absolute loan or whether other options are being considered, because it suggests there's a wide package of options potentially being suggested there, but just for absolute clarity, is it a loan? Okay,
so
Jane, yeah.
I'm sorry that I haven't been as clear as as is obviously necessary. This is non-recurring support in the same way that Perth and Kinross Council have provided non-recurring support. There is no ask for repayment. It's non-recurring support being passed across this year for us to carry forward in our reserves, for us to apply to balance our budget and allow us to focus on longer term transformation. It really is as simple as that, and it has been given with huge commitment to joint working, for the longer term good of health and social care partnerships across Tayside. I'm not sure that I can, is it actually as simple as that?
That's fine. No, I thought that was what you had said in answer to the earlier question, but I just wanted absolute clarity because there was because it was discussed twice there was perhaps an area of a grey area that was becoming open, and obviously NHS boards are used to bridging loans from the government, etc. So I just wanted absolute clarity as to what we were agreeing, but that's fine. Thank you, Jane. If I can get on to my main points then. So I just want confirmation around the 4% that's being included in terms of the National Pay Award that's being given to NHS staff. It says it's being separately funded. Is that being fully funded, including pension, national insurance contributions, etc.? The whole thing is fully funded?
Yes, that would be in line with the normal approach, which is to recognise the full cost implications of that uplift and for that to be fully funded.
That's great, thank you very much. Can I also then ask around the risk sharing agreement, which has also been mentioned obviously in your opening remarks. This is something that has been running on for as long as I've been a member of the board, so nearly 4 years at this point, and I think it was running on before that. So it's a long running issue. Can perhaps the Chief Officer give us an updated position on where we're at with the progress on the risk sharing agreement? Because obviously we've been trying to move to a proportional rather than operational split for, as I say, a number of years at this point.
Yeah, so we are very keen to progress and to try to reconcile that and achieve some parity with the arrangements that exist in Dundee and Angus in relation to their integration schemes and risk sharing agreements. However, we haven't been able to focus any great attention on this at the moment. And have only recently received advice from Scottish Government that they do, notwithstanding the recommendations of Derek Feely's review, want each of the health and social care partnerships and statutory partners to progress the review of integration schemes, and we will need to address the risk sharing agreement in the context of that review. Members of the IJB will remember that we had previously flagged up the need for us to review our integration scheme 5 years on. We then received information from government that we should be focusing instead on priorities to do with COVID pandemic. But more recently, the government have been back in touch to say they expect us to review and to revise our integration scheme and to progress that over the summer. So the risk sharing agreement will be an integral part of that. And that will require the partners who sign up to the integration scheme to agree to amend the current arrangements to, as I say, achieve consistency with the arrangements elsewhere in Tayside.
Okay, thank you, Chief Officer. I mean, I understand your answer there, and I think obviously we're getting some conflicting messages there from the government in some respects, but I think that obviously we are going to try and progress it by the end of the year. I wonder if you could perhaps give us a commitment that we will get a formal update on. I know I ask about this at almost every meeting, but perhaps if we could get a formal update from yourself towards, say, September time. I think there's usually a board meeting around September on this issue, because as I say, it has been an underrunning current of the board's discussions for the past number of years. I appreciate that we're doing that within the wider context of the integration scheme. However, given that we've not managed to resolve this particular point in the past 5 years, I think there is obviously a need to have an intense bit of dialogue around this to try and make the progress on this. So I'm wondering if you can perhaps give us a commitment around that.
Yes, certainly. I think that's a reasonable timescale, particularly in the context of the advances that we'll need to make with the integration scheme. So I can commit certainly to give you an update, a formal update. What I can't commit is that every partner will necessarily agree that there needs to be a shift to the current arrangements. But let's see how we go with that kind of update.
Only asking for things in your control. Thank you. And final two questions. On community hospital transformation, I'm just wondering where we're at in terms of those savings, because obviously they've played an incredibly critical role in the past year, and they obviously play a critical role normally anyway, but I'm just wondering if you can give us an update on that. And my final question is actually for the Chair. You'll be pleased to hear.
Okay, thank you. I shall respond to the question about the review of rehabilitation beds, and I'm conscious, because she appeared earlier on my screen, that Evelyn Devine, the Head of Health, is with us and may wish to supplement or contribute to my answer. Essentially, we had brought forward a proposal either last January or the December before that, in relation to our ambition to carry out a formal review and option appraisal of the number of rehabilitative beds in Perth and Kinross, and those are principally the beds in community hospitals, to determine whether or not they were still needed, whether we had the right beds in the right place, providing the right care. It won't surprise members to know that we haven't made any great progress in that regard because of the focus of the pandemic, which arrived upon us a couple of months later. It remains in our ambition to review our community hospital beds. I think we need to do that in the context of what we have learned over the past 12 months. Like so many of our transformation plans or our service redesign plans, we need to review those through the lens of COVID, just to ensure that they're still valid, they're still relevant, they're still affordable. What we've also though got is the benefit of having significantly accelerated the delivery of our local enhanced integrated care service, our LINK service. So that is providing an alternative that is enabling people to be supported more effectively at home rather than having to go into hospital. And that, combined with the actions that we've advanced in relation to delayed discharge, which mean that we've got people out of hospital and home sooner, will certainly be factors that will influence our determination on the numbers of beds and the locality of beds as we progress this review, as we've committed to do in the course of the next financial year. So, with apologies that for reasons that hopefully people will appreciate, we have lost that year, we are no less keen to advance the review, and I hope that that will provide a degree of assurance to Councillor McDade and others who know that this has been something that has been around for some time now.
Thank you, Chief Officer. Yeah, I appreciate that the review will be done in the context of, and that's exactly what I was looking for in terms of my answer, so thank you. My final question is for the Chair, and really it's in the wider context of the budget. I think our staff have done a good job, as they always do, in terms of helping manage to balance the situation, but every year our financial situation becomes more and more difficult. Obviously, pressures are increased, and although we continue to come up with innovative ways to make savings, there is a fundamental issue that often we just don't actually have enough money. Now, obviously, the allocation of money coming to both the Council and the NHS is allocated in the large part by the Scottish Government, and the Chair and the Vice Chair regularly attend meetings with the Health Secretary, Ministers and senior civil servants in Scottish Government. And what I'm really looking to ask yourself, Chair, is what conversations have you had around our financial settlements with Scottish Government officials, and indeed what individual cases have you been making for Perth and Kinross? Because we obviously have certain disadvantages in our area that do not exist in other areas, our rural geography being a clear point where it costs us more money to deliver certain services than it does in other places. And that puts a significant extra strain on our budget. So I'm just wondering if you can perhaps give us a bit of detail about some of your discussions.
Yeah, I mean, the discussions with the Cabinet Secretary in particular, and Bob might be able to speak more about his involvement with as an officer of the IJB chairs and vice chairs group, and he is more actively involved in that side of things. But from the point of view of the discussions with the Cabinet Secretary, these have been, specific agendas set, not general discussions, if you know what I mean. But having said that, for example, during the most recent discussion that we had on the Feely report, I made a specific point. One of the concerns that's been mentioned by a number of people is that we can't have a one-size-fits-all approach going forward, and that there are significant challenges to service delivery when you're talking about not just rural areas but remote rural areas, and you know, it manifests itself in all sorts of different ways, be it in acute mental health situations, for example, down to you know, care at home delivery, and the logistics of you know, travel in bad weather, for example. Just to give one example, and I don't, you know, I mean, I don't shirk from making these representations, but this, you know, we're having this development session next week. Is it next? Yeah, next week, to get the contributions of IJB members more representatively, if you like, that we can then and will then make to a future meeting with whoever the new cabinet secretary is after the 6th of May. And we've been asked to do that, and we've been asked to reflect the specific challenges that we see for our particular IJBs. So the opportunity is there. You know, I've given a flavour for it, but the real opportunity is following the development session that we're just about to have. But perhaps, Bob, if you're there, Bob, you would care to add comments from your perspective?
Sorry, Eric, I was on mute there. I think maybe we could have a further discussion on that at the moment. I've still got quite a lot of other things in my head, but from what I heard so far, that seems to be reasonable. But can I come back to you on that, Eric? Probably not today. Yes,
okay.
Thanks, Eric. I mean, I appreciate your point, and I think that's I'm looking forward to the discussion. I do think, and I just want to make the point, and I've made it before, that I think we need to be better at making advocating for our position. I think you and I have both written previously over the past number of years to various ministers and health secretaries independently often, and sometimes jointly, around certain issues, and I do just think that as a board we need to get better at advocating for our unique position, because often we do have unique situations that we can advocate for and press that case. But I think I'm pleased that we're having this discussion next week following the Feely report.
Yeah, 100% agree with you, and I can give you that assurance that following that discussion, representations will be made as appropriate. Okay, thanks. Now moving on to Norman Pratt. Norman.
Thanks very much. So I'm maybe a 5-year veteran of Tayside's transformation program, and that always had fine aspirations, but delivery was certainly very faltering in the initial phase anyway, for some years. And then we have the other issue that if we take all our big ticket items, cardio, mental health, diabetes, COVID, even cancer, the approaches to these things are probably going to be in the realm of invest to save and social prescribing, i.e. they will take some considerable time. I also think they require a degree of working together, planning on a Tayside basis, but also the right lead from Scottish Government, and perhaps we're getting there, but you know, it's a big ask. Even in Dundee, when we'd had quite a really impressive presentation on this, we still struggled to get that into, to make those concrete changes. So, I just think it's something that as an IJB and IJBs together, we've really got to take seriously, but not count our chickens and not expect any major savings in the short term. Thank you.
No, thanks. I'm not sure if there was a question in there, but Jane, did
no, there was a concern,
yeah.
and the question might be, how do we make it real?
Yeah.
If I could come in, Chair.
Yes.
I recognise your concerns, Norman, and one of the reasons that I am pushing my colleagues on the executive management team around strategies is to ensure that as we bring forward strategies to the Integration Joint Board, the investment, disinvestment implications of those strategies is as clear and upfront as it can be. Where we will kind of go down a route, as you've kind of described, is where there's broad brush intention and not sufficient understanding of the investment and disinvestment that is going to be required to deliver. And that's the difference between a financial strategy and what I have seen in the past is not in this board, but in my career, as strategic intention that's not matched up to the financial plan. And my colleagues on EMT will know that we and are fully behind me in bringing forward to the IJB our strategic arrangements that will ensure those two things are much more closely aligned. So probably at this stage, that's all I would want to say. That I recognise your concern. I'm working hard with colleagues to make sure that strategies are not just high-level intention. They are costed and they are understood from that context. Gordon, I'm sure will want to come in.
Yeah.
Thank you.
Thanks, Gordon.
No, I mean, I think your comments are very helpful and well made, Norman, and particularly the idea of developments and investments in around social prescribing and the ways in which we can work within our communities to keep people well and keep them connected will require that investment, and that requires to come from somewhere, either through savings and disinvestment elsewhere or through additional specific funding that comes from government or in additional investment from our statutory partners. So what our ambition would be over the coming year would be to have a series of community strategies pertaining to particular care groups that will articulate how we are going to give effect for those care groups to the strategic priorities and ambitions of the IJB in relation to preventative services that are person-centred, that are strengthening communities, that represent best value, etc., etc. So that should be the vehicle for us assuring the IJB that we are delivering on the strategic commissioning plan. It should be underpinned by a very robust financial framework, and where we are bringing forward those strategies and proposals, we should be very clear about what the measures of success and effectiveness will be, both in relation to productivity and qualitative measures, but equally in terms of the impact and outcomes in terms of the lives of our citizens in Perth and Kinross. So now that we are beginning to hopefully, and I'm touching wood here, get a bit of headspace as we move into recovery from COVID, these are the kinds of activities that we're now revisiting and will be progressing hopefully over the summer months to bring these types of reports more regularly back to the IJB and to demonstrate how we're giving effect to the strategic commissioning plan.
Thank you very much.
Well, thank you. Thanks for your question, Norman. Moving on now to Ronnie Erskine. Ronnie.
Thank you, Eric, and thanks for the papers today. I do have a few questions to run through and some thoughts and observations on which are all interlinked with the questions, but the first thought was actually just to remind members what we agreed a year ago, which is a 3-year budget for the IJB, with year 2, 21-22, generating a £400,000 surplus that would be paid back on the health side. This year we are looking for a 1.4 million shortfall to be funded. So compared to a year ago, which I always do with my finance hat on, I'll go back and look at what we said before, and last year was by no means a typical year in any way, and I fully accept that, but our position has moved by 1.8 million from last year to this, and I thought it's best just to start off with that. But my kind of thoughts are, if I just can pull the paper up in front of me, what members are being asked to do today is set out in paragraph 1, and I think Gordon alluded to this earlier, but in 1.2, what we've been asked to do quite clearly and specifically is approve the revenue budget for 21-22. That's not approve further discussions or this is a work in progress and it's going to change next month. It's approve the budget. That's what that means to me. So there are comments around ongoing discussions and around directions being issued. Now, directions, as far as I understand, and I'm still a novice at this, are to provide resource and finance for the programme that's set out in the budget. The difficulty I've got with that today is I don't actually know what I'm being asked to approve. If we go back to Jane's comments near the start of the meeting, Jane helpfully went through some post-budget paper changes that have taken place over the last week or two in relation to various aspects. Unfortunately, we don't have a paper in front of us that reflects those numbers. So the paper with the budget in it today is not the one that we'd be approving. It's something different to that. Second point is, when I got this paper a week or so back, I had some conversations just with various people to try and see how this fitted in with other IJBs, but also with the understanding around the bridging finance element, which is a key element of the paper. And I had that conversation with Stuart Lyle a few days back. Stuart was quite unequivocal in his comment that his expectation is any bridging finance will be repaid. So I'm confused. I'm confused, having heard earlier on in the meeting that quite clearly, and I'm hoping Jane can clarify this, but I think Jane mentioned that the funding did not need to be repaid. Now, these are polar opposite positions, and if the funding doesn't need to be repaid, then I've got less of an issue. If it does need to be repaid, then I'm back to Bob's point around how is this going to be repaid, over what period, and in what way? Is it similar to the 3-year budget draft that was prepared last year, where I appreciate, you know, with the best efforts of the IJB, we tried to get a 3-year budget, and yet health, because it works in a 1-year cycle, found that quite difficult to manage. So given that uncertainty and the changes to the figures, I can't see any way that I could endorse the paper that's in front of us today. And fortunately, we've got a meeting at the end of April where I would hope we could be presented with a paper with the up-to-date figures in it that we could then sign off. Because I think we do, if I can just add a further point to what Bob and others have said, I think we do need some something in black and white on paper to back up the very positive words that both Gordon and Jane have mentioned on transformational change and commitment to achieving savings over the next period of months. As an IJB budget member, and the on-board guidance that Scottish Government gives us specifically has a duty for financial stewardship in front of us. I just can't have any wiggle room in that as an accountant. I just can't. I need to see something that is quite clear in black and white and concrete. So that's my first set of points. I do have some other points, Eric. I would probably appreciate it.
Yeah, I think we can possibly just try and deal with these ones, Ronnie, first, and then come back.
These first. Okay.
Yeah.
Okay.
Thank you.
If I could reply to you. There's a few things in there, Ronnie. I suppose the first thing I would say is that, as you'll have picked up from my previous responses, I'm very, very happy to bring a further formal update to the IJB in April. It's very fortunate that we have that meeting, and I'd be very comfortable that that was the position that the board took. The last few days, as you will have picked up from the number of updates that I've given you, there are a number of things going on here at the very last minute, by the Scottish Government. On one hand, the meeting that we had with Stuart Lyle was on Monday of this week. So to actually put that through formally a paper, even to bring forward a kind of formal budget amendment, has just been too time constraining, and I apologise that that's not been possible for this meeting. In relation to the commitment that we've had from Stuart Lyle, it was a very, very supportive discussion. It was clear that there's no formal requirement to pay back. We agreed that we would have regular meetings to keep under review the financial positions of both NHS Tayside and the IJBs, and that's the formal position between the Chief Officer, myself, and with the Director of Finance. So I can only assume that his thinking has moved on, Ronnie, since his discussions with you, and that may be on the back of the conversations he's had both with myself and with Dave Berry in Dundee Health and Social Care Partnership, who are seeking a significant non-recurring support that significantly exceeds ours. So I can't be any clearer than that in relation to the meeting that we've had with Stuart Lyle on Monday of this week. In relation to reassurances around future transformation, I'm sure Gordon will wish to come in on that, but the IJB have very helpfully agreed a one-year budget, and that's what's before you today. I'm not sure, over and above that, what could have been expected in terms of detailed assurances about 3-year transformation that could possibly have gone in today's paper, given that you have up until this point been supportive of a one-year approach.
Eric,
thank you, Jane, and just if I can just add, Ronnie, as well. I mean, I would just support what Jane has said there in relation to the timing of events. As you're aware from the NHS non-executive board discussions that we had last week, I think it was, things were moving at the last minute in terms of how the deficit was going to be addressed, and that there was positive discussions. I too had a positive discussion with Stuart Lyle last week, and so I mean it has been last minute. It's the nature of the beast with these budget discussions, just as it was with Perth and Kinross Council, where the Scottish budget was approved 14 hours before the Perth and Kinross Council budget discussions took place, and so verbal updates were given, and that is, as far as I'm at least concerned. So obviously you're entitled to form your own views, but as far as I'm concerned, that is far from ideal, but it seems to be the way of things, that everything is last minute, and it's all a little bit accelerated just at the last moment. But I mean, your concerns are valid. I mean, it's not ideal, and but it is where we are. But if you want to come back on that or ask your other questions.
Yes, a bit of both. Thank you, Eric, and thanks, Jane. And just firstly, two things really, certainly from my own point of view, I fully support a one-year budget, and I like the idea of a 3-year budget, but there was just no possibility of that this year, and I wasn't suggesting that from my comments. So if that's what's been picked up, that's not what I intended. Fully support the one-year budget, and I fully also appreciate and understand the late changes and adjustments that we've received in the run-up to the end of March. That is totally understandable. and in fact is one of the prime reasons why I'm proposing that we approve the budget at the end of April and not at the end of March, because we just haven't had the time to pull all these elements into a paper that not only has the financial adjustments in it, but also has something along the lines of the formal agreement that you have with Stuart down in writing, so that IJB members can see what that agreement, how it's worded, and whether we feel comfortable approving that as a board. That was all I wanted to say on that.
Okay, so just on that then, and I see I'm conscious Councillor Purvis also wants to come in, but I think given the importance of the point you raised there and the timing of the approval or otherwise of this budget, our hands are, I believe, tied, but Jane will perhaps explain that better than I can.
My recommendation to board members today would be to approve the budget before you today, because all that remains within that is valid, but we can bring forward that could be an approval in principle, subject to, because what we don't want to be in a position, Ronnie, is to be having a further detailed full examination of all of the budget as it sits before you today. I would be recommending to members that they approve in principle the budget today, recognising that there has been late verbal updates where full assurance has been provided, but that for a full budget approval you wait until the April meeting.
I stand to be corrected therefore, but my understanding was that, and the very reason we're having this meeting today is because in terms of the integration scheme, we are required to set a budget today by the end of March. Unless I'm incorrect with that, but perhaps. Councillor Purvis, do you want to come in?
Sorry, Eric, I hadn't finished, if you don't mind, rather than asking another member to come in. If that's
okay. No, fair enough, Ronnie. Okay, but I see these comments, and I will come to Councillors Purvis and McDade. But my understanding is, as I've just stated, that we are required in terms of the integration scheme to set a budget by the 31st of March.
I guess I think we're all just going to have to come to our individual independent IJB member views on that as a board. Of course. Because my view is I don't know what budget I'm approving, so I have a problem with that. Okay. If I could move on, I do have a couple of other questions just briefly. One is around, and I know you explained this to me before, Jane, I think, or to the group, the breakdown of the 2.9 million and the 1 million in the social care element. I think it's paragraph 3.7.1. It would be helpful to understand as part of a future budget paper how that split was arrived at. I would quite like to see that down on paper again. Satisfies the nerd in me as a finance person. And the kind of final comment in relation to savings and transformation is, I think my suggestion here again, and it's only my view, but I've taken my individual responsibilities as a board member seriously here, is that any transformation or savings programme should come to the board by the end of June at the latest. I would be concerned about a funding gap, even if we were able to bridge it in some way with either a loan or a grant or whatever term it turns out to be. We need to find a way of agreeing as a collective how to narrow that gap. And that was all I wanted to say. Just really appreciate all the work and effort. I know it's been really difficult and the timing is completely impossible at the end of March. And we had this meeting, I think, on the 31st of March last year as well. It is a stretch. But now my final comment would be we maybe have to approve in the budget of the 31st of March, but I don't think we should approve something with our eyes closed as to what it is we're actually approving. Thank you.
Okay, thanks. Do you wish to come back at all on these further points, Jane?
Yeah, if I may, I fully recognise, Ronnie, at 3.7.1 it would have been helpful for us to have expanded and been very clear around the split of that and how we'd arrived at that, and apologies for that. We could send out an update to members that just clarifies that. So apologies that I had picked it up myself reading the paper afresh this morning. In relation, I mean, Gordon will want to come in. The development of a full transformation plan to bring forward to the IJB in June is not something I think that we could agree to today as a officer team who are still recovering and remobilising on the back of COVID, but I will, I'm sure Gordon will want to come back on that.
Okay, thank you.
Yeah, I would just endorse that, Jane. I mean, I think I would want to pay testament to the significant commitment and professionalism that staff in the Health and Social Care Partnership have shown over the last 12 months in the face of a global pandemic. Their achievements have been remarkable. It's unfortunate if not everyone is able to recognise how hard people have been working in trying to mitigate the impact of the pandemic on services, on staff, on communities and on citizens. It's unfortunate that the Director of Finance of NHS Tayside met with you before he was prepared perhaps to meet with us on Monday, Ronnie. I think that it's important that IJB members take their financial advice from the Chief Finance Officer of the IJB, and we will be thoughtful and take cognizance of the various comments that you've made in order to try to see if we can inform your understanding, support you with any more information you might need, and respond as effectively as we can, as we continue to do, to looking at how we can achieve financial balance. That won't be, as Jane says, by necessarily delivering a full transformation programme to the next IJB. But as you say, it's down to individual members of the IJB today to determine whether they feel confident in approving the budget and taking the recommendation of the Chief Financial Officer of Perth and Kinross Integration Joint Board.
Okay, thank you, Gordon. And
please respond to two of these points, and I'll be very brief, just very, very brief, if that's okay.
Yeah, I'm conscious. The reason I'm rushing a little bit, Ronnie, is because I see Maureen wants to speak, and I know she has to be out of the building by 5 o'clock. So, okay, if you can be brief, please.
It's just two responses, no response required. I hope you didn't pick up, Gordon, that I wasn't being appreciative of staff and their work over the last year. I've said this in other forums and meetings. I fully appreciate all the work that staff have done. And if I have said that in the meeting, then I retract that. But I am appreciative of all the efforts of the finance team, but also the broader team. I know what a small team you have, and you and the team actually have put a huge amount of effort in what has been impossibly difficult circumstances. So I just did want to say that. Also to say the discussion with Stuart that I had was partly to understand this from the NHS Tayside angle, because there are issues in relation to the NHS Tayside budget position and its relation to the Scottish Government. So that was really, it wasn't a discussion just about IJB, it was about how does this impact on NHS Tayside and going forward into 21-2. So I thought I would make that point. Thank you very much.
No, thank you for that. And okay, so I have comments requested. Firstly, I have Ian McCartney from way back, it seems ages ago, and Ian, apologies, I will come to you and to Councillors Purvis and McDade, but I'm conscious, I know that Maureen is going to get either have to leave or get locked in the building that she's in very shortly. So I'm going to come to Maureen Summers for her comment at this point, please.
Yes, I'll be as brief as I can. It's just I've been scrolling up and down the report just now and looking for where the mental health budget is mentioned. It's all about social care, and the only mention of mental health is about the complex care packages for learning disabilities and mental health. And I just wondered, is the mental health allocation not included in this budget report? And also the other thing I wanted to ask was, you mentioned that the mental health had been awarded £120 million as part of the Mental Health and Recovery Renewal Fund, and I wondered if you could tell me, that's a Scottish figure, I wondered if anyone was in a position to give me what the Tayside allocation was, and further breaking it down to what the P&K allocation was. Thank you.
Thank you,
Thank
Jane.
you, Chair. Yeah, very happy to. Maureen, this paper is in respect of our whole budget, our delegated services for health and for social care. That, of course, includes mental health, as it includes drugs and alcohol, learning disabilities, primary care, community health, hospital services, community hospitals. None of these are mentioned in detail in this report, and it is, the report takes a high-level approach to the budget, and is not, it would not be expected that it would mention individual services. In relation to the £120 million mental health fund that Scottish Government have announced, as I said in my introduction, at this stage we do not know what the Tayside allocation is or what the Perth and Kinross Integration Joint Board allocation is, and as soon as we do, we will brief IJB members.
Thank you. Thank you.
Thank you. Thank you. Thanks for your question, Maureen, and thanks for your answer, Jane. Okay, I'm going to go back to Ian McCartney, who's been very patient. And Ian, you're very welcome to. This is perhaps not your first maiden speech you've ever made, but you're very welcome to have the floor at the moment.
It's very much like some cabinet meetings I've attended, but thank you, Jane. It's just a short question about the budget in relation to special needs adults, whether they're on day service provision or are users in terms of residential care, and whether that's identified in the budget going forward, and are they included in any proposed plan for transformational change?
Thank you. I'm going to pass over to my colleagues Gordon and Kenny Ogilvie, who will absolutely be able to provide assurance of the budget provision in respect of those services.
Right, thanks.
Thanks, Jane. Thanks. Thanks, Ian. I don't think Kenny Ogilvie, unfortunately, is with us today, so I'm happy to take that. Kenny is currently the interim head of social work. Absolutely, the commitments in this budget extend to provide a range of supports and services to adults with learning disabilities, physical disabilities, with autism, and increasingly also we're seeing investment coming forward that is supporting people with the most profound and multiple disabilities and complex care needs, to enable them to live as safely and independently and in a way that is connected with their local communities, out with institutions and in homely environments. So we have a complex care transformation programme that is underway, and we have a very strong track record of investing in services that seek to support people with disabilities in their own communities. We also commission services from the independent sector. We've got a range of providers who provide services on our behalf in this regard, as well as our own respite and day services, as well as 2 residential care homes that the council run. So in the same way as we haven't surfaced this as particular budget lines, within this budget there is significant investment on a recurring basis and in a transformational and developmental way that seeks to further invest in the kinds of support that you've alluded to for the people who need that support. So I hope that provides a degree of assurance at a fairly high level, but as our relationship develops and your membership of the IJB continues, and perhaps also within the context of some induction support to you, we can give you much more information on the work that we're doing and the work that we hope to do that hopefully will address some of those concerns.
Yeah, thanks. I'm very happy with that, and I'll come and see you over the weekend.
That's great. Thanks, Ian. Thank you.
Thank you.
Okay, now Councillor Purvis.
Thank you, Councillor Drysdale. So I had a number of different comments, if I may. First on the the comments that Mr. Erskine made. I do agree with him that it's not an ideal situation that we don't have all of the information, although I think that is not surprising given that we haven't had all the information that we wanted from NHS data in the past. So I think actually the fact that we've got more clarity today is a significant improvement. And I know that in the past we hadn't got to the stage where we were, I think the first time I was with a budget, we couldn't agree the full budget until after the end of the previous financial year, which was in contravention with the integration scheme, as the chair has already alluded to. So the fact that we had made progress in the subsequent years and agreeing the budget, sometimes not balanced, which is what we're going to have the same thing today, should the Integration Joint Board take the decision to follow the recommendation and to agree the budget. So I think that that's not unusual. In the past, that would have just meant we were going straight into recovery measures and that we would have to determine in year how we were going to address that overspend that was included in the budget. Well, not an overspend, but the deficit that was included in the budget. So I have no issue agreeing the budget today. I think that's the right thing to do because we have to agree a budget in line with the integration scheme. It's unfortunate that we have a gap, but at least we have some clarity as to how that gap is going to be addressed, and I don't think that's uncommon with the previous position that we had got to in previous years. So that's just the point I make. I agree with, we'd like to have all the information, and I think it's positive some of the things that Jane Smith said. The NHS Tayside have now committed to having more collaborative meetings throughout the year, so hopefully when we get to next year's budget we aren't in the same situation. Clearly there are additional factors with this year because of the COVID situation, but I don't have an issue on that basis of agreeing the budget today. I also think it's really positive that the social care budget is balanced. Yes, not on a recurring basis, although it's only a few $100,000 that it will be out of balance on a recurring basis, but that with the non-recurring money from the underspends previously, we are able to set a balanced budget this year, which I think is a great improvement, and that's really positive. There's still a lot of unknowns, as we've alluded to already, a number of us, in terms of the contributions policy and some of the other savings that we're going to have to look at going forward in transformation projects. On the health side and on the social care, I agree that I would like to see some more clarity on the transformation plans going forward. But I do agree with Jane and with Gordon that I don't think June is a realistic timescale, given that we're still going to be dealing with the effects of the pandemic. Hopefully sometime maybe after the summer and the autumn we could do a review, giving us enough time to set the budget for the following year with the full knowledge, and hopefully that budget that we will be setting would be again over a period of 3 years, so that in addition to the savings that have been delayed, we can look at are there any other transformation projects that we can progress or indeed adapt ones that we've already committed to. Clearly there are a lot of implications, particularly on the social care side with the Feely review, that might need us to revise our plans, and we need to take all of that information into account. So just to say thank you again to Jane, to Gordon, to Donna, and to everyone else who's worked on the budget, and also thank you to members for their contribution as part of the budget review group. Clearly it's not our preference to be setting a one-year budget or to have had slightly reduced meeting timetable for that budget review group process, but I think within the parameters of what we've had to work, I think we've done a good job, and I'm very pleased to approve the budget should that need to go to a vote today, which I hope it doesn't, based on those points I've made. Thank you.
Thank you, Callum. And final comment I have on the chat function is from Councillor McDade.
Thank you very much, Chair. I would echo a lot of what Councillor Purvis has outlined. I also would endorse the comments of the Chief Officer short time ago in response to some of Mr. Erskine's points. I would like to establish, because I'm a bit uncertain really as to whether Mr. Erskine is proposing an amendment to today's budget, and if he is, can you please see the terms of any amendment so that we can consider that. members will be aware that obviously Standing Order 12.1 sets down that a decision of the board cannot be revoked within 6 months, so we cannot be bringing this back in April. Obviously, we do regular financial monitoring where we would consider the terms of the ongoing financial performance of the IJB, but we would not reopen the budget situation in a month's time. I entirely agree with Mr. Erskine and others around the fact that it's unfortunate that we're in this situation where we do not have the full information that we would like when we are finalising the final stages of the budget. But that seems to be an issue from an NHS side point of view, and I do think it's very unfortunate that there seems to be discussions going on that are not involving either all board members or indeed all of our officers, it would seem. So, you know, first of all, I would like to establish, is there an amendment, and if there is an amendment, can we get a copy of it so we can see the terms of that amendment? I think it's important that, you know, we remind ourselves we are here as members of the IJB, and therefore we are considering the information provided by our officers in the report in front of us and on their advice. We're not here to consider the angles of any other organisations or bodies that we may or may not be members of, and I think that June is indeed an unrealistic time for a transformation plan given the pressure officers are under. I think we do need, and I have said this repeatedly throughout the past number of years, we should be doing financial planning throughout the year. We need BRGs going on during the year so that when we get to the end of the year we have very detailed plans of which the entire board is supportive of. But I don't think June is a realistic, a few months down the line is not realistic for a comprehensive transformation plan given all the other work that is going on. And finally, I would just like to express my thanks to Jane and Gordon, Donna and indeed Callum as chair of the BRG for the leadership of the budget process, and particularly to Jane, who sat down and took time out of her diary to sit down with me to go through items when I was not able to attend one of the other BRG meetings. So clarity on those items, please, Chair.
No, thanks for these comments, and thanks for everybody for their contributions to the debate this afternoon. I think we've had a very thorough discussion from a number of angles on what is obviously an extremely important paper. So at the end of the debate we come to the recommendations, and if I can refer you to section 1 of the paper before us, and just taking it in reverse order, it is recommended that the IJB requests the Chief Officer to issue the necessary directions to NHS Tayside and Perth and Kinross Council to note the work being undertaken to determine in more detail the COVID costs for 21-22 in line with the Perth and Kinross Health and Social Care Partnership remobilisation plan. To note the ongoing discussions to identify further solutions to deliver financial balance in relation to health budgets, which we've just been talking about, and to approve the revenue budget for 2021-22. Are we agreed?
Agreed.
Okay.
Agreed.
Okay.
May I come in, Eric?
So is that you, Bob?
Yes, I've just been trying to pick up the kind of train of conversation today, and I think Jane provided a helpful line that might give us some assurance. We also have the minute record as well, which has rightly raised the kind of questions that councillors and others have asked today, and it may be that we just amend the substantive, approve the revenue budget for 21-22, and we could simply say approval in principle subject to assurances provided, which is an accurate record of what was actually said. And I think that might help to allay some of the questions that have been raised, and I think it also covers the board as well, and it enables the officers to pursue the assurances in due course with Stuart Lyle and within their own other budget holders. So I think that might be one way forward. I'm sorry I wasn't cited on your actual vote, Eric, but I do think that might be worthy of support, as in principle, as suggested by Jane earlier.
Okay, we have a point of order from Councillor McDade, but can I just say that the discussion is finished. We have had a vote, but I'm happy at the moment to take a point of order from Councillor McDade.
Well, I don't know, Eric. I wasn't asked to vote.
We haven't had a vote.
We haven't had a vote, no.
So I'll take the point of order first of all from Councillor McDade.
Thank you very much, Chair. Under the terms of the standing orders, unless an amendment is moved, then the board agrees the item. There is no amendment on the table, and therefore the board has agreed the item. So the board has just agreed this item. It is approved by the board, unless members, and actually we have agreed it. So I mean, there's not really a going back on it at this point.
We haven't agreed it, Xander, because not all members have had the opportunity to respond to Eric's question.
Yeah, I haven't had a chance to vote. I should be asked to vote as a member of the board. Everybody should be individually asked to give their vote.
If I can just interject at this point, thank you. The point has been made, and I also see that in the chat, Ronnie Erskine has asked a question, which is, can we confirm we are complying with section 9.15 of the integration scheme, resetting budget after council tax? What I would say at this point in time is and the record will show that I asked members whether we are agreed, and some voices said agreed, and then my recollection is that Mr. Benson came in with his comments. So I'm going to take advice on this matter from the clerk, and in that regard I would like to call a recess for 5 minutes, maybe 10 minutes, and I will take advice from the clerk, and we can resume. The time is now 17:04. Let's endeavour to come back by 17:10, but it may be a minute or two after that. So this meeting is now in recess. Thank you.
Well, you've chosen the meeting to join us for.
Yes, sorry about that, Patricia. Right, can you hear me now? Yeah, unmuted.
I said you've chosen a lively afternoon to join us.
Right, okay. All right, Patricia. Sorry about that, Patricia. I seem to have been.
Okay, hi, I'm back. The meeting will shortly be called out of recess once we're sure that officers, oh, hang on, officers are back on the call. And after I've sorted out my phone here, bear with me. Hello. Okay, I'm back now. This meeting is now back in session. Okay, so I have taken advice on the matter. Given the importance of the item before us and taking account of Dr. Pratt's comments that he is confused and unsure about what he is mandated to do, the view I'm going to take as chair here is that I am going to go around the voting members and ask them individually whether they agree with the paper's recommendation or not. And I am going to ask people individually, if you do not agree with the recommendation in the paper, I'm going to ask you whether you have a competent amendment to propose to the motion. And if there is a proposed amendment that comes forward, I will ask the clerk to determine and to assist me in determining whether such an amendment is indeed competent, and we can take it from there. So let me just bear with me again, get my other computer up here. And I'm just going to go to the voting members in the order in which they are on the agenda item, and so I won't start with myself.
Sorry,
I'll start with.
Chair, can I just interject and suggest, in terms of process, my suggestion would be that we have the report with the recommendations in front of us. From a process point of view, it may be more suggestive that yourself as chair, if you're content to move the report, and we seek a seconder, and then we take any amendments to the report. But that would be my suggestion, and then if necessary, if there is a division, we can go to a vote. So I'm going to assume that you are moving the report.
Okay, yeah, I'm happy to move the report.
And I see that
you have a seconder, and I appear to have a seconder in Councillor McDade. Is that, can you confirm that, Councillor McDade?
Yes.
Benefit of the tape, so to speak.
Yes, very happy to second the report as on the order paper.
So, Chair, we're now looking to see if there are any amendments from any other members that we don't agree the report.
But before we do that, I see, Mr. Erskine, you have what, although you don't state it as a point of order, it sounds like it's a point of order. Do you want to ask the clerk your question?
Thank you, Chair. Eric, as you know, I am not well trained in the standing orders, and so the process is not something that is familiar to me, but it's more familiar to council members who are used to this approach. My question relates to section 9.15 in the integration scheme, which is the section that I can find that relates to the date that we require to set a budget for the IJB. It doesn't mention 31st of March. It does mention the budget should be set the day after, or that budget requisitions should be sent the day after the council tax is legally required to be set. So my question is, effectively, are we already in breach of the integration scheme, and the 31st of March date that we talked about earlier for setting a budget is irrelevant? I would appreciate if Scott could respond to that one, please.
I'll possibly bring in the Chief Financial Officer and the Chief Officer if he wishes as well, but my understanding is that we are competent to defer, as we've done in previous years, to defer consideration of this budget to our next meeting in April. But Jane may wish to also comment.
Yeah, if I could just come in, there is no question, and Ronnie, you will understand this, that we will be criticised significantly for not, by our external auditors, for not setting the budget by the 31st of March. It's best practice across the public sector, albeit that it's not set out in the integration scheme. There is precedent. That was in the very early years of the IJB, when budget processes were not as streamlined, so there is an expectation across the country that IJBs are in a position to set their budget by the 31st of March. However, there is nothing in legal terms that would prevent, that would get in the way of this being delayed. But however, it would be a huge disappointment to me.
No, thanks. It was the clarification of the difference between expectation and legal requirement. I think that's very clear. Thank you.
Okay, thank you. Okay, so so we have a motion.
Sorry, Eric, can I come in? Can I just come in here for a point of clarification, right?
Of course.
Which I think is really important for me before I'm asked to vote on this. My understanding from my discussions with NHS Tayside is that the bridging finance has got to be repaid, right? That appears not to be Jane's understanding of it, that the bridging finance doesn't have to be repaid. Now that seems quite a fundamental difference of understanding here between NHS Tayside and the IJB. And I think we need to be really clear on this. Is this money to be repaid? Because that is clearly the view of NHS Tayside. Or is this money not to be repaid? I think the board members need to be clear on that, because I'm getting two conflicting sides of the same story, and I think it's not clear to me which one is the correct one. And I think before we vote on anything, we need to know that. Have we got to pay this money back?
Yes, okay, but I get your point, and it is a very important point. I feel obliged to comment that, you know, we have already had the debate and we should have tried to resolve these issues earlier. I thought we had, but I'm going to ask Jane Smith to come in and from her point of view as Chief Financial Officer of this body, to clarify her understanding of the situation. You know, it's, you know, we are here, we are all here as members of the Integration Joint Board, acting independently based on the advice of the officers that that are before us today, and I'm very clear on that. You know, if there is a difference of view between the officers of this body and those of another body. That is unfortunate, absolutely unfortunate. But my clear understanding is here that we are requesting and receiving clarity from the Chief Officer and the Chief Financial Officer of this body that we are board members of during this meeting. However, I'll ask Jane just to clarify the position.
Thank you, Chair. And I'm disappointed that I'm having to clarify it for the third time, but I will do so. There is no difference in view between the officers of NHS Tayside and those of Perth and Kinross Health and Social Care Partnership in relation to this issue. There is no formal requirement for the non-recurring support being provided to balance our financial plan to be repaid.
Okay, thank you for that, and I hope that answers your question, Pat.
Yeah.
Gordon Patterson has also clarified in the chat, and I'll just read it out. Section 9.15 does state that the IJB will approve and provide direction to the partners before the start of the IJB's financial year in the relevant year, and regarding the functions that are being directed. However, I now need to go to Councillor McDade, who had a point of order.
Thank you, Chair. I would like to seek advice from the monitoring officer regarding a number of members have now expressed that they are considering advice that they have received as members of NHS Tayside's board from NHS Tayside staff. Is that we are required to take the advice of IJB officers. Could the monitoring officer please advise around this?
Chair, yes. In terms of the code of conduct, then obviously IJB members are all aware of their respective roles, and that they may have a role as a Perth and Kinross councillor, or a member of NHS Tayside board, or a member of the Perth and Kinross Integration Joint Board. I'm happy to follow up any discussions after the meeting in terms of clarifying those roles, but I'm acknowledging the fact that the Chief Financial Officer has again provided clarity to the members in terms of her role on the board, and in terms of those members' role on this board as well. So I would hope that the members would be taking that advice on board and making their decision based on the information that they're getting from the Chief Financial Officer and the Chief Officer.
Thank you for that.
Clarity thank you. Anyway.
Yeah, okay, thank you. And Councillor Purvis, you have a point of clarification.
Thank you, Chair. It was just simply on the previous comment that Mr. Erskine made in the chat about 9.15. I note that the Chief Officer has already clarified that it does state that we have to set a budget and give direction before the end of the year, but specifically on the point about the council tax and putting in a requisition in advance of the council tax setting. I did ask this of the Chief Financial Officer at the Budget Review Group, and my understanding was through the previous work and the information that had come to the IJB, both in the form of papers and a verbal update, and indeed the work the Budget Review Group had done, that at an operational level those two requisitions had been made already, and therefore in compliance with the integration scheme. So just for the record, I think it would be useful to clarify that if the Chief Financial Officer could do so.
Thank you, Callum. The integration scheme, it's important to realise, whilst it's there, does not lend itself to the cut and thrust of ongoing budget discussions that we have with both partners. Certainly the budget process with PKC has allowed a clear requisition to be fed into the PKC budget process, and for that to ultimately be agreed through the PKC budget process. On the NHS Tayside side of things, that budget process does not exist in the same way. The requisition has not, whilst it has been made, we have not had the same kind of formal response, and ultimately the discussions around that have taken place right up until Monday of this week, whereby our full requisition is now being met. So I don't know whether that answers your question, Carl, or whether I've missed something fundamental there. Please feel free to follow up.
The point was just that we had, through those discussions, made, whether it's been on a formal bit of paper or whatever, but that requisition in terms of our requirements, whether NHS Tayside met it or not, is irrelevant in terms of meeting the requirements of the integration scheme. But that requisition has been made.
Absolutely, through the
just clarify that.
Yes, absolutely, through the process which we've gone through with IJB members up until this point.
Okay, thank you, Chief Financial Officer.
Okay, thank you. I'm going to call the debate to a close at this point, and where we got to in terms of the recommendation in the paper. I had moved approval of the recommendation, and Councillor McDade had seconded my motion. Do I have an amendment? I'll give it a few more seconds to see if we have any amendments coming forward.
Chair, just for clarity, and for all members' benefits, I think some members were expecting that we would go through the report and the recommendations with a straight vote, yes or no, or agree and accept. Just what we are looking for at this stage is, in terms of when we call an amendment, is a counter proposal to the 4 different sections within the recommendation. So if any member wishes to propose anything different to what the recommendations in the report, it's at this point that we're looking for you to come forward and state what those proposed changes would be.
Thanks for that clarity, Scott. Are there any such proposals?
Eric, could I ask a point of clarification here? Just following Scott's point, should there be no amendments, does this mean we will still have the opportunity to vote yes or no to this paper, section by section?
No.
No, but because... Sorry, Chair.
On you go, Scott, on you go, you.
Okay.
Thanks. Yeah, so because there is nothing coming forward as an amendment to change it, there wouldn't be anything to vote on. So what we would, in order to have a vote, we would need another proposal counteracting the recommendations of the report for then members to vote either on the proposal that Eric and Xander have put forward, or a counter proposal by someone else, seconded by someone else, so that we know what we're voting for. Because if we were to go through the report and vote yes or no, the vote for yes would be to agree the report. The vote for no, there would be no actual proposal to do, something different from the report. We were looking for members to state what it is they would be wanting to do if we're not approving the report.
I have a further question, Scott, based on that. I would assume that one of the options, if the report is not to be approved, is simply to say members do not approve the report. Is that an alternative motion?
I think that would be part of an alternative amendment, but it would then be, asking the board or asking members to confirm what the board would then do, given that we have a statutory process to approve the budget. Are you looking to defer consideration of the budget or something completely different?
I think that comes back to the point about Jane's comment, the advice she gave us earlier on, which is there no legal requirement to set a budget by the 31st of March. So if it's not accepted, then we would presumably be receiving a further report at our next IJB.
So are you, just before Jane comes in, so your amendment would be to defer consideration of the report and the budget until the next meeting of the IJB in April?
If I'm just not familiar with the way this is done, please excuse me, and I see Xander will correct me on my deficiencies in relation to the standing orders here, okay, but I don't understand the process, so I thought we could just, if we didn't agree with the report, just state that. But if we need to submit an alternative, then do we need Do we need a minute or two to get the format of that correct?
Yeah, well, yeah, I mean, we're in live session here, Ronnie, and
sure.
you know, we are at a stage where we have had the debate, we've renewed the debate, we've you know, and you know, but the discussions are continuing here. Councillor McDade has made a point of order, and I'll ask him to come in at this point in time.
Thank you, Chair. I just want to say I'm not quite sure. You know, obviously, if members have an amendment, that's fine. If they don't have an amendment, I'm not quite sure what the purpose of deferring the budget would be at that point, given that members obviously are required to accept the view of our own officers, and therefore, if they are choosing to defer something based on advice they have received from the officers of a different organisation, I think that surely would be a breach of the Code of Conduct.
Okay, thank you.
Was that point of order? Sorry, Chair. Was that a point of order, or was that a comment, or was that really just a rather negative comment? It didn't sound like a point of order to me.
You know, positions are being taken here. I see another point of order from Councillor Purvis, and then I'm going to, after I've heard the point of order from Councillor Purvis, I am going to ask whether anyone has a proposed amendment. If somebody does have a proposed amendment, I would ask them to set out what that is, and if they're able to attract somebody to second said amendment, then fine, we can go to a vote. If not, this discussion will be concluded at that point. Councillor Purvis.
Thank you, Chair. Just a further point of order, if I may, and you know, as you know, and I'm sure we all agree that I'm absolutely for trying to facilitate amendments if we can, and we should be permissive in our interpretation of things to try and facilitate that, so that if there is a disagreement, that can be brought about to a resolution through a vote if necessary. I'm just wondering though if the clerk could clarify in relation to 9.15, which the Chief Officer has helpfully put in the chat again, in the scheme of administration, scheme of integration of the Integration Joint Board, which says the IJB will approve and provide direction to the partners before the start of the IJB's financial year. So I'm just wondering that as a point of principle, is it competent to have an amendment that does not approve it? You know, I understand that there might want to be an amendment that says, you know, we want to review things in year or look at that. Absolutely fine, don't have any issue with that, and even that could be incorporated into the motion if that would be a way of bringing the two different positions together. But just as a point of principle, is that competent, Clerk? Thank you.
I think it's difficult to comment because at the moment I haven't heard any proposed amendment or what, because at the moment we have the paper moved, which includes that final recommendation about the direction. So I think I would need to hear what any amendment would be or proposed amendment would be before giving any comment, and I'm sure the Chief Financial Officer or Chief Officer may wish to as well. So I think, as you say, Chair, we need to hear if there is any proposed amendment to do something different to what the recommendations state, or if members are happy to approve the report.
Okay, so I mean, I'm seeing Mr. Erskine is asking to prepare an amendment in short recess with yourself, Scott. I don't know if that is practically possible. Perhaps you can advise on that.
I'm happy, Chair, if members are agreed to have a recess. I'm happy to have any discussion with any member about composing and the competency of any amendment.
Okay, how do we facilitate that though?
I think what I would probably do is I could leave this and set up a separate Teams call with Mr. Erskine, and I would probably look to bring in again the Chief Financial Officer, the Chief Officer, and possibly my colleague, the Legal Advisor to the Board, for clarity. So if we go into recess, and I'll attempt to set up a separate conversation with Mr. Erskine. Okay,
I shall agree to a further recess now. Time is 17:38, and I would look to resume at 17:50. Thank you. Just to say to anybody who can hear me, I think there've been difficulty in connecting others to the call to discuss a possible amendment. So I think we'll give it another 2 or 3 minutes and try to resume at 5 to 6. Thank you. Apologies for this, everyone. I've had a further message from Scott Henry, and we should be able to resume in 2 minutes. Good evening, everybody. I think colleagues are now coming back into the meeting. While we're waiting, can I just check in terms of voting members here, do we have Councillor McDade?
Yes, I am present, and Councillor Purvis is on the phone.
Thank you. And Councillor Duff, I see you're there. Pat? Pat Kilpatrick, are you there?
Yeah, I'm here, Eric.
Thank you. Norman?
Yeah.
Okay, so we're looking for Bob and we're looking for Ronnie. Do we have either Bob or Ronnie back?
Chair, we're just bringing Ronnie back into the meeting. He had to leave this one and set up a separate meeting with us, so we should hopefully just be bringing Ronnie back in just now.
Okay, I'll give it 2 minutes. And do we have Gordon and Jane coming back as well? Yeah.
Yeah, they should be joining us any minute.
That should be Ronnie back in now, Chair.
Sorry, Ronnie, and who back in?
Ronnie's definitely back in. I think Gordon is also here. I'm just checking to see if Jane is.
Are we able to get Bob Benson back into the meeting?
I don't know if he's away, is he?
Bob wasn't involved in our separate meeting, so I'm not sure.
Yeah, there's a phone number still attached, so Bob should still be on the line.
No, the phone number that's attached is Councillor Purvis. It would appear that Bob has hung up.
He's hung up. He's lost a connection, maybe.
Well, okay, so we're going to start in 1 minute's time. I think we are quoted, and it's now 6:15 p.m. So we do need to recommence the meeting. So give it a few seconds to see if Bob is returning.
Chair, I think Mr. Benson dropped out of the meeting some time ago. It's not in the last few minutes.
All right. Okay.
I think. Thank you.
Okay. Okay, Scott, do you want to explain to me what's happened in the recess meeting, please?
Yeah, so we've had a discussion, and my colleague Lisa Simpson, as a legal advisor to the board, also joined a discussion with myself, my colleague Adam, and Gordon and Jane with Ronnie. So I believe Ronnie has a comment to make, and possibly Jane, just in relation to where we're at with the report.
Okay, thank you for that. Ronnie, can I ask you to make your comment? Thanks.
Thank you, Chair, and thanks everyone for being so tolerant in terms of time. This is a new process for me, so it's taken a few minutes to go through and understand it better. And thanks, the legal advice from Lisa and Scott as well has been very helpful. What I wanted to say is I have a better understanding now, I think, of the one-year nature of the budget and the fact that any bridging finance issue would not impact in that year, and I'm happy with that. And also the broader point around the uncertainty of the budget and the fact that things can change in year, and that we would get updates through the year should there be any changes to the position. That would be helpful to hear that from Jane in particular. So accepting that kind of fluid nature of the budget, I fully accept the advice that we have from the Chief Financial Officer. I'm more than happy with that, and I think the paper itself, from further discussions, does not need any substantive numerical modifications that I thought it may need. So I'm quite happy not to propose an amendment or a motion or whatever the technical term is.
Okay, thank you. And Jane, do you wish to make a further comment?
Yes, thank you, Chair. I wanted just to say that I fully recognise the concern that's been expressed around the verbal update today around a significant but very positive bridging finance, and recognition that it has been a verbal update. And we're very happy to update the budget figures following this meeting for that 1.4 million and send that round to members so they have that very clear position statement. And as Ronnie says, recognising the very uncertain landscape, that we will commit to provide very robust monitoring reports that give regular updates on risk, uncertainty and opportunity moving forward as best we can, and we fully recognise the need to do that given the shifting sands that we're operating on. So that is a full commitment to me, recognising the assurance required of our board members.
Okay, thank you. So without further ado, therefore, where we got to in the meeting was a motion to accept the recommendations as contained in the paper, which was moved by myself, seconded by Councillor McDade. I'll ask the question again, do we have an amendment? I better go into the chat function. There does not appear to be an amendment. So that being the case, the budget is approved in accordance with the paper. And thank you to the Chief Officer, Chief Financial Officer, to Scott Henry, to Lisa Simpson for assisting a member in getting to this position. Okay, thank you for your time and forbearance this afternoon, and everyone, and I look forward to seeing you again for the development session in a week or so's time. Thanks, and the meeting is now closed. Thank you.